Hello, my name is Dr. Cassidy, and today I'm going to talk to you about how you can open a cash practice and what your patients are really expecting and looking for when they book an appointment with a chiropractor or another healthcare professional that is cash based or doesn't accept insurance. If you're new to our channel, please subscribe. We are prenatal and pediatric chiropractors who also share our business related tips and tricks, especially those relating to niching down, specialty care, and cash practices. Dr. Beadle shared with you how we have structured our treatment plans or the lack thereof. We do not do structured treatment plans, so if you're interested in that, I really encourage you to go watch that video. First things first, we have structured our prices to be based on the amount of time our doctors spend with patients. What this means is whatever gets done in that allotted time, regardless of the modalities or the number of adjustments or the soft tissue techniques used, regardless of what that is, we just charge one flat rate for the time we have spent with the patient. If your patients are paying out of pocket for their care, they're going to expect results, and in order to do that, you're going to need the time with them. But that's not necessarily a bad thing, because what happens is you will be able to spend more time with less patients, but be better compensated for that time. I personally think this is where the specialty care or niche care piece is really beneficial for cash practices, because it allows you to funnel what your responsibilities are for the patients that you have and monitor expectations that they place on you. Let me say a little bit more about that. In terms of what we provide, we are a specialty clinic for prenatal, postpartum, and pediatric care. We focus on a key set of conditions, and we are really clear about what we offer and what we don't. For example, we are experts in the biomechanical causes of pain during pregnancy, but we don't extend our care to detailed nutrition advice. Our patients that come to us know that because we have been really clear and transparent about our marketing. Dr. Jessie shared a lot about that in a different video. You should check that out if you're interested in that. I want to be really clear that you don't have to specialize in moms and babies in order for a cash practice to work. I just think specializing overall does lead you to an advantage, because you can really monitor your patient's expectations and they will know what you offer and what you don't. That being said, you do need to get results. So you will need longer patient appointments to incorporate other techniques beyond your adjusting. And that can be a lot of different things. It can be nutrition consultation. It can be soft tissue techniques like a laser cupping, acupuncture if you're certified. You name it, you can add on to the adjusting part of your care, lengthen your appointment times, get better results, and ultimately you're going to lead to a better patient experience, which is where I want to go next. Your patient's experience in your clinic, in your space, is everything. They are paying for your care, yes. They're paying for results, yes. But they need to know that that money is worthwhile, and overall they have an experience that they enjoy because they're paying out of pocket for it. Your space is a really big piece of how you can affect your patient experience beyond just what you provide for care. And you can make your clients feel welcomed as soon as they walk in the door with really small details in your space. I always like to say that our space, personally, it doesn't feel sterile. It doesn't feel like a vet clinic. You know, we try to make it really bright and colorful and welcoming because that's what's really appealing to our patients and our clientele, who are mothers and their children. So your space is really important, and you need to curate a space not just for what you like and what your styles are, but a space that's really made for your patients. You make a space that your patients really love and appreciate by paying attention to the details. Pay attention to the wall art that you have. Pay attention to how you display and store your medical supplies. If you have gloves, if you have activator, if you're a different profession and you have things that aren't exactly pretty or appealing to the eye, how can you make that part of your space in a beautiful way? Other details we pay attention to are simple things like our greeting when you walk in the door and the small tour that we give all of our new patients. Our space in Minnesota is really cozy, but we've always had the tradition of walking new patients around our space so they know the lay of the land, and of course they feel really welcome. They know what each room is for, they know where the bathroom is, where the nursing and changing space is, and everything that they may need. Plus, it gives them a chance to experience the clinic as a whole if they are just being exposed to the mom's care that we offer or just the kids' care that we offer. And the final detail we pay attention to is smell. One of the first things that you'll hear every new patient say when they walk into our space is, "Oh my goodness, it smells so good in here." And I think smell is such an overlooked piece of a lot of healthcare facilities. Honestly, I was gonna say brands, but I think a lot of small businesses do it well. I think of like clothing stores and boutiques and things like that. They'll have a candle burning or something like that. So when you walk in, there is a really welcoming smell. We have simply just peppermint essential oils diffusing, and we keep that really consistent. So every time you are in our space, you're smelling that peppermint. It smells incredible. I want to end this video by encouraging you to ask yourself this question, and that is, why would someone pay to come and see you out of pocket versus going to someone that accepts their insurance? Beyond just thinking of logistics, and maybe even it's not that far off as far as a price goes, but what sets you apart that makes it worth it, that makes your care worth the price that you have set it at, that is likely higher than some of your competitors? If you can answer that question confidently, you will likely do really well in a cash model or a cash clinic. Remember to pay attention to the details. Remember that your patients are paying to get results, yes, and they're paying to have an incredible experience with you as a provider and the space that you have curated specifically for them. If you enjoyed this video, please subscribe to our YouTube channel. Stay tuned for more business-related content, or see what we've already shared already. I'll include the playlist here. We have already created a lot of amazing videos on how we have niched down as specialty chiropractors and how we function as a cash practice.